Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating and relatively unexplored area of veterinary medicine, pit viper envenomation in pregnant dogs. This episode is based on a recent study that describes the successful management of pit viper envenomation in 2 pregnant dogs, offering valuable insights for veterinarians in endemic areas. Our story begins with the understanding that snake envenomation is a common occurrence in small animals, especially in regions where venomous snakes thrive. Pit vipers, belonging to the family Crotalidae, are among the most common culprits in the United States. It's estimated that around 150,000 cases of pit viper envenomation are reported annually in dogs and cats. However, the effects and outcomes of such envenomation during pregnancy are not well documented in veterinary medicine. The study we're discussing focuses on 2 cases of pregnant dogs that presented to a university teaching hospital with acute soft tissue, swelling, and bleeding. The clinical signs and diagnostic findings were consistent with envenomation by crotalid snakes, more commonly known as pit vipers. Both dogs received medical management, including antivenom administration in 1 case, and both survived the envenomation with minimal complications, eventually whelping healthy puppies. Let's dive into the specifics of these cases. Case number 1. Our first patient was a 2-year, 10-month-old boxer, weighing in at 30 kilograms. She was brought to the veterinary teaching hospital 1 hour after her owner discovered a bleeding wound on her left front paw. The injury occurred while she was outside in a fenced yard. The owner suspected the dog was pregnant, as she had been bred via live cover 4 weeks prior to the incident. Within 15 minutes of the owner noticing the wound, the boxer became acutely lethargic and swelling began to develop in the affected limb. Upon initial examination at the hospital, the dog was panting, had an elevated heart rate of 200 beats per minute, and displayed 2 actively bleeding puncture wounds on the dorsal aspect of her left front paw, accompanied by mild to moderate swelling extending up her leg. The mammary glands were also noticeably enlarged. Using the Colorado Pain Scoring Scale, she was given a pain score of 1 out of 4. Based on her history and clinical signs, the veterinary team suspected pit viper envenomation. A series of diagnostic tests were performed, including a venostat profile, packed cell volume, total solids, blood smear, and activated clotting time. The packed cell volume was slightly decreased at 35%, while total solids were within normal limits. The serum appeared mildly hemolyzed, but the activated clotting time was normal. Blood gas analysis revealed mild metabolic acidosis and hyperlactatemia with incomplete respiratory compensation. Electrolyte abnormalities included mild hyponatremia, hypokalemia, and hypomagnesemia. The blood smear indicated an estimated platelet count of 150,000 to 180,000 per microliter. Given the dog's elevated heart rate and the swelling at the bite site, she was assigned a Snakebite severity score of 2 and admitted to the intensive care unit for supportive care and continuous monitoring. Intravenous fluid therapy was initiated using lactated Ringer solution, and she was given tramadol orally for pain relief. Within 1 hour of presentation, her heart rate decreased to 170 beats per minute, and the limb swelling did not worsen. By 2 hours post-presentation, her heart rate had normalized, and her snakebite severity score was reduced to 1. The following day, 12 hours after presentation, repeat blood tests came back normal, and the activated clotting time remained normal. The swelling around the wound was stable compared to the previous night. A brief ultrasound examination showed normal fetal heart rates. The dog was discharged 16 hours after her initial presentation, with instructions for follow-up fetal heart rate monitoring. Fetal heart rates remained normal on days 39 and 48 after live cover. Abdominal radiographs taken on day 48 of gestation revealed 8 fetuses. On day 63 of gestation, the boxer delivered 9 puppies vaginally at home without any reported complications. According to the owner, the puppies had no apparent congenital defects and all survived to at least 1 year of age. Case number 2. Next, we have a 1-year-old golden retriever, weighing 34 kilograms, who presented to the same university teaching hospital with a moderately swollen wound on the rostral aspect of her right upper lip. The injury was discovered after she had been outside unsupervised for 2 hours. She arrived at the hospital approximately 3.5 hours after the incident. The golden retriever had been bred via live cover 19 days prior, but her pregnancy had not been confirmed at the time of presentation. On initial evaluation, The dog was panting with mildly increased respiratory effort and normal airway sounds. Her temperature, heart rate, capillary refill time, and pulse rate and quality were all normal. 2 puncture wounds were present on her upper lip, with swelling extending along the ventral mandible. There was no active bleeding around the puncture wounds, but blood-tinged saliva was visible. The dog showed minor sensitivity at the bite site and was assigned a pain score of 1 out of 4. The veterinary team suspected pit viper envenomation. The packed cell volume and activated clotting time were measured and found to be normal. Her blood pressure was slightly elevated. Based on the local wound appearance and mild hypertension, she was assigned a snakebite severity score of 2. The golden retriever was admitted to the intensive care unit for overnight supportive care and monitoring. 1 hour after presentation, her respiratory effort remained mildly increased. Treatment with 1 vial of a specific antivenom was initiated as a continuous rate infusion. 6 hours after presentation, following completion of the antivenom infusion, intravenous fluid therapy was started using lactated ringer solution. 8 hours after presentation, the dog remained clinically stable with normal vital signs, and her snakebite severity score was reduced to 1. The following morning, 14 hours after presentation, the dog's facial swelling had progressed from the right rostral maxillary lip to the ventral neck. An open wound, resulting from focal bite site necrosis, was noted on the right side of her face. Her appetite was normal, and intravenous fluid therapy was discontinued. Antibiotic therapy was initiated. The dog remained comfortable without any analgesic therapy, and her snakebite severity score remained at 1 for the rest of her hospitalization. She was discharged 26 hours after her initial presentation with a 2-week course of antibiotics. Follow-up conversations with the owner confirmed that the swelling had resolved within 2 weeks of the envenomation. However, the story doesn't end there for our golden retriever. 20 days later, she was brought back to the same veterinary teaching hospital for evaluation of facial swelling that was noticed after she had been playing outside for 1 hour. She was now known to be 38 days pregnant. On initial evaluation, she was panting, but all other vital signs were within normal limits. Puncture wounds were identified on the left ventral aspect of the muzzle, with moderate bilateral asymmetrical submandibular swelling, more pronounced on the left side. She was given a pain score of 1 out of 4. Once again, pit viper envenomation was suspected. Laboratory tests showed a normal packed cell volume and total solids, and the activated clotting time was normal. She was assigned a snakebite severity score of 1, based on the wound appearance and the absence of systemic abnormalities. The dog was admitted to the intensive care unit for overnight supportive care and monitoring. Treatment, consisting of 1 vial of the same antivenom, was immediately started as a continuous rate infusion over a 4-hour period. 3 hours after initiation of antivenom therapy, the dog developed a mild increase in respiratory effort, while other physical parameters remained stable. Following completion of the antivenom infusion, intravenous fluid therapy was started. 8 hours after presentation, her snakebite severity score increased to 2, given the persistent mild increase in respiratory effort. The snakebite severity score increased to 416 hours after presentation, after the dog vomited a small amount of brown food and liquid, suspected to be additional effects of the envenomation. The following morning, 20 hours after presentation, the dog's facial swelling had worsened, but she remained comfortable. Her snakebite severity score was reduced to 2, given the resolution of the gastrointestinal signs and dyspnea, but the progression in local wound appearance. Fluid therapy was discontinued after 14 hours when the intravenous catheter was found to be non-functional. Repeat blood tests showed a slightly decreased packed cell volume, but normal total solids. The activated clotting time remained normal. She was discharged 20 hours after presentation for at-home monitoring. On day 63 of gestation, the golden retriever delivered 13 puppies vaginally at home, with no reported complications. According to the owner, none of the puppies had any apparent congenital defects, and all survived to at least 1 year of age. These 2 cases provide valuable insights into the management of pit viper envenomation in pregnant dogs. Pit viper envenomation in humans can result in multisystemic effects and significant local tissue damage. Envenomation in pregnant humans can also lead to adverse effects on the fetus, including placental abruption, early labor, maternal hemorrhage, fetal anemia, and potentially fetal malformations. Snake venom can induce uterine contractions and have direct toxic effects on the placenta. Some studies in humans suggest that poor fetal outcome is more common when envenomation occurs earlier in pregnancy, but fetal loss has been reported at all stages of pregnancy. The decision to administer antivenom is typically based on the severity of presentation and progression of clinical signs. The Snakebite Severity Score system evaluates the severity of clinical signs across 6 categories, 5 body systems, and the local wound appearance. While the Snakebite Severity Score has been validated for use in humans, it has been adapted for use in veterinary medicine and found to be helpful for assessing animals. However, it should not be the only factor in guiding antivenom administration. Antivenom is considered a crucial component in the treatment of pit viper envenomation, as it neutralizes the circulating venom, limiting the progression of neuropathies, alleviating pain, and reversing coagulopathy. However, the potential for allergic reactions is a significant concern, particularly in animals that may not need it. These reactions can manifest as anaphylactoid reactions, anaphylaxis, and delayed serum sickness. The safety of antivenom therapy in pregnant dogs and cats is largely unknown. Human case series have reported variable rates of fetal death and malformations in pregnant women treated with antivenom. The occurrence of poor fetal outcomes may reflect the severity of the mother's condition. Other potential factors include direct embryotoxicity of the venom or teratogenic effects of preservatives in some antivenom products. It's also unclear to what extent antivenom crosses the placenta. Despite the potential risks, pregnancy is generally not considered a contraindication to antivenom administration in humans. In the cases presented, neither dog experienced long-term negative effects from the antivenom. One of the dogs did experience some vomiting, diarrhea, and mildly increased respiratory effort, which may have represented a minor allergic reaction or progression of the envenomation. In conclusion, this case report provides valuable insights into the successful management of pit viper envenomation in pregnant dogs. The cases suggest that positive outcomes are achievable following envenomation and the use of antivenom during pregnancy in dogs. However, it's important to note that further prospective studies are necessary to provide more comprehensive guidance on managing these cases and improving outcomes. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.